Idarubicin HCl vial is a medication used to treat a specific type of cancer called leukemia. It is classified as an anthracycline drug and functions by slowing down or halting the growth of cancer cells. This medication is typically administered by a healthcare professional through injection into a vein. It is important to follow the dosage instructions provided by your doctor. The timing of administration may vary depending on individual circumstances, so it is best to consult with your healthcare provider regarding the optimal timing for taking this medication. When using Idarubicin HCl vial, it will be administered by a healthcare professional through an injection into a vein. The dosage will depend on your medical condition, body size, and how you respond to the treatment. If the medication accidentally comes into contact with your skin, wash the area immediately with soap and water. If it gets into your eye, rinse with water for 15 minutes and seek medical help. It's important to drink plenty of fluids while using this medication, unless your doctor advises otherwise. This can help reduce the risk of certain side effects, such as increased uric acid levels. Some common side effects of Idarubicin HCl vial may include nausea, vomiting, abdominal cramps, diarrhea, headache, and temporary hair loss. Your doctor may prescribe medication to help with these symptoms, and eating small meals and limiting activity may also help. It's important to remember that the benefit of taking this medication outweighs the risk of these side effects for most people. It's important to contact your doctor if you experience severe abdominal pain, mental/mood changes, numbness/tingling of arms/legs, rash/blisters on palms of hands/soles of feet, unusual bleeding/bruising, or pain or sores in the mouth and throat. In some cases, these symptoms may be signs of a serious reaction and require immediate medical attention. While allergic reactions to this medication are rare, it's important to seek medical help if you notice any symptoms of a serious allergic reaction, such as rash, swelling, trouble breathing, or severe dizziness. This is not a complete list of possible side effects, so if you notice any other unusual effects, it's important to contact your doctor. And if you have any concerns or questions about the medication, don't hesitate to reach out to your healthcare provider. When using Idarubicin HCl vial, it should only be administered through a slow injection into a vein. It should not be injected into a muscle or under the skin, as this can cause serious damage if the medication leaks. If you notice any redness, pain, or swelling at the injection site, contact your doctor immediately. It's important to be aware that Idarubicin may rarely cause severe heart problems, which could be fatal. This risk is influenced by factors like your dose, medical history, and previous use of similar drugs. If you experience irregular heartbeat, shortness of breath, swelling ankles/feet, unusual tiredness, or sudden weight gain, notify your doctor right away. Additionally, Idarubicin can lead to blood and bone marrow disorders, which can affect your body's ability to stop bleeding or fight infection. If you develop easy bleeding/bruising or signs of infection, such as a persistent sore throat, fever, or chills, inform your doctor immediately. There is also a very rare risk of developing other cancers, such as secondary leukemia, when using this medication in combination with certain anti-cancer drugs or radiation treatment. It's important to consult your doctor for more details and to discuss any concerns. Before starting treatment with Idarubicin, it's crucial to inform your doctor if you have liver or kidney problems, as your dose may need to be adjusted to accommodate these conditions. Before starting Idarubicin HCl vial, it's important to let your doctor know if you have any allergies, especially to other medications in the same class. Also, make sure to discuss your medical history, including any blood disorders, heart disease, kidney or liver disease, or recent radiation treatment, as these may affect your ability to use this medication. Idarubicin can increase your risk of infections, so it's important to avoid contact with anyone who has a contagious illness. You should also talk to your doctor before getting any vaccinations while taking this medication. Be cautious with sharp objects and avoid contact sports to lower your risk of injury while using Idarubicin. Additionally, let your doctor and dentist know about all the medications you're taking before any surgery. If you are pregnant or planning to become pregnant, talk to your doctor before using Idarubicin. It's important to use reliable birth control during treatment and for a period of time after your last dose. Men using this medication should also use reliable birth control to prevent pregnancy. It's best to avoid breastfeeding while using Idarubicin, as it's not clear whether the drug passes into breast milk. Consult your doctor before breastfeeding while using this medication. When taking idarubicin HCl vial, it's important to be aware of potential interactions with other medications. This can affect how well the medication works and may increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Do not make any changes to your medication dosage without consulting your doctor first. There are certain products that may interact with idarubicin HCl vial, such as other drugs that affect the heart, including trastuzumab and anthracyclines like doxorubicin. Be sure to discuss any concerns or questions about potential interactions with your healthcare provider. If you or someone else has taken too much idarubicin HCl vial and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, while in Canada, you can reach out to a provincial poison control center. Symptoms of an overdose may include an irregular heartbeat and severe nausea or vomiting. It's crucial to act quickly in these situations to ensure the best possible outcome. When using idarubicin HCl vial, it is important to undergo lab and/or medical tests to monitor kidney, liver, and heart function, as well as complete blood count. It is crucial to keep all medical and lab appointments and consult your doctor for more information. Make sure to take each dose of idarubicin HCl vial on time. If you happen to miss a dose, make sure to consult your doctor or pharmacist for a new dosing schedule. This medication, idarubicin HCl vial, is administered in a clinical setting and is not meant to be stored at home. It is used to treat certain types of cancer, such as leukemia. The dosage and timing of administration will be determined by a healthcare professional based on the individual's specific condition. It is important to follow the healthcare professional's instructions regarding the use of this medication. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.